Waking up with a stiff neck or dealing with that nagging ache at the end of a workday is incredibly common. But how do you know if it's just a temporary kink or something you actually need a chiropractor? I'm Dr. Dave at the Toronto Neck and Back Pain Clinic, and today I'm going to break down exactly when you should have it looked at and when it's safe for you to just let it rest. First, let's talk about when you probably don't need to rush in. If your pain is mild, if it's a dull ache that came on after a long flight or a bad night's sleep, and most importantly, it's starting to improve on its own within 24 to 48 hours, gentle movement and rest are usually going to be enough. If you have full range of motion and no sharp shooting pains, it's likely just mechanical stiffness. However, if after 3 or so days that's not even improving, then that's something you want to get checked as well. However, you should definitely book an assessment if you are experiencing any of these 4 warning signs. Sharp shooting pain, especially if it travels down your shoulder, arm, or into the fingers, this can be a sign of nerve irritation, as can numbness or tingling. If your arm or hand feels pins and needles or weak, don't wait on that one. Make sure you get an assessment as well. If the pain is persistent, if it hasn't improved after a few days, especially if it's been there for a week or longer, or if the pain is getting worse, that's a good indicator that that's something you want to get some help for as well. And then severe restriction. If you can't turn your head fully one side or the other way without severe pain, and especially if that's happening right from the beginning and it's not getting better, then you want to get that checked out for sure. Ignoring warning signs can let small issues turn into chronic problems. So if you're in the Toronto area and you're dealing with any of these red flags, let's get it sorted out. Click the link in the video, book an initial assessment with me at the Toronto Neck and Back Pain Clinic, and we'll get you moving comfortably again. I'll see you at the clinic.